The Cincinnati Stroke Scale is incredibly useful, but there's a few points that you may be getting wrong. But we're going to straighten that out on this One for the Road. With almost a quarter century of use, the Cincinnati Pre-Hospital Stroke Scale has become almost universal. It is the go-to assessment for recognizing potential stroke patients. We've been using this assessment tool going all the way back to when Harry Potter was still just a book. The Spice Girls were still spicy. Mike Tyson was still snacking on people's ears. However, over the decades, there have been some common errors and misconceptions about the proper way to perform some aspects of these assessments. I want to be clear. Let's just clear up a few common errors that I see when I see folks performing the Cincinnati Stroke Scale. The first one is pronator drift, right? Oftentimes I hear people say something like, I want you to hold your hands out in front of you like Superman and close your eyes. And we often do it with the palms in the palms down position. But actually, when we're assessing for pronator drift, it's better to do it with the patient's palms turned upward. So reached out and stretched out in front of them with the palms up. The reason for that is the muscles of supination are weaker than the muscles of pronation. So it's harder to do. It's harder for a patient to get their palms upward, but it also makes the test more sensitive, right? When the palms are down, we're mainly looking for some sort of outward drift from the shoulder muscle that would show us weakness in the shoulder muscle. But when they're forced to turn their palms upward, we can also sometimes just detect an inward rotation of the hand or a falling down of the hand that can make that test more sensitive. The second one is that repeat after me test, right? So we'll ask them to repeat a phrase, something like, you can't teach an old dog new tricks, right? Something with a lot of hard consonants. And we're listening for that slurred speech, for something that would indicate some muscular weakness in the tongue or in the mouth. But remember that that test is not just a test for slurred speech. That test is, can they accomplish the entire set of instructions? So it's a test of hearing, it's a test of memory, and it's a test for speech. It's also a test of cognition. Are they able to understand what it is that you're saying? So you give them that instruction. Can they understand it? If they normally hear just fine, did they hear it correctly? Are they able to hold the sentence that you gave them in their memory? And then are they able to repeat it back to you without slurring their speech, right? And if they fail at any one of those components, then we register that as a failure, regardless if there was slurred speech involved or not. So the Cincinnati Stroke Scale, it is still a great tool for ruling someone in for a possible stroke. But remember, get those palms up when we're testing for pronator drift, and repeat after me. It's not just about the slurred speech. Hey, thank you for watching. I'm Steve Whitehead, and that was One for the Road.